So on the board exam, we want to be able to understand the signs of increased airway resistance and decreasing compliance, as well as the causes and solutions or treatments for these problems. And so let's start with increasing airway resistance. And one of the most common causes of that is secretions in the airway. Okay, so obviously if you have um, secretions blocking the airflow in the bronchial tubes, it's going to make it difficult for air to move in and out, and that's going to increase the airway resistance. Okay, so as air tries to flow past that, that's going to increase the pressure as well, and it's going to cause the peak inspiratory pressure to rise. All right, so secretions are a common cause, and a treatment obviously would just be to suction your patient. If you see the peak inspiratory pressure is rising and you hear rhonchi in the lungs when you auscultate, then we would just go ahead and suction our patient to treat that. Okay, and then bronchoconstriction is also a common cause of increased airway resistance. Okay, so if we have a patient with asthma or with COPD and their smooth muscle surrounding their bronchial tube starts to kind of tighten here, and then as a result it gets much more narrow. It makes it difficult for air to flow through there also. So that's also going to increase the airway resistance and increase the peak inspiratory pressure. And so obviously a good treatment for bronchoconstriction would be to give a bronchodilator. Okay, so other causes of increased airway resistance may be related to the endotracheal tube. You could have a patient who's biting the ET tube. All right, and that's going to make that passageway through the endotracheal tube more narrow and increase the airway resistance. And so we would consider sedating that patient or maybe putting an oral airway into the patient's mouth to prevent them from biting the ET tube. Sometimes the ET tube gets kinked also, just as a matter of repositioning the endotracheal tube so that it doesn't become kinked. And sometimes the endotracheal tube may simply be too small for the patient, which would also increase airway resistance. And so we could consider exchanging that ET tube for a larger ET tube. And so all of these problems, what they're going to do is they are going to increase the peak inspiratory pressure. Okay? But they're not going to do anything to the plateau pressure. So the plateau pressure should remain the same regardless of an increase in peak inspiratory pressure. All right, and that's an important distinction to understand between increasing airway resistance and decreasing compliance. And so let's go ahead and just talk about decreasing compliance next. What are some of the things that can cause a decrease in compliance? Well, anything that prevents the lungs from distending. It could be something such as ARDS. Okay, so we have very stiff lungs in ARDS, and it's difficult to expand them. Same thing with pulmonary fibrosis. Those lungs are also very stiff and difficult to distend or expand. All right. Another cause would be a pneumothorax. When air gets trapped inside or outside the lungs with a pneumothorax, it makes it difficult to expand and also increases the plateau pressure, which is the hallmark sign of decreasing compliance. Okay, other items that may cause decreased compliance include things like scoliosis, morbid obesity would also restrict lung expansion. And so how do we treat some of these problems that cause a decrease in compliance? Well, it can be a little more complicated than problems with increased airway resistance, but for example, with ARDS, we would want to titrate the PEEP. We want to increase it to its most therapeutic level, as long as it doesn't have any negative consequence on our hemodynamic parameters. As far as pneumothorax, we could consider a chest tube But really, there's not much we could do with pulmonary fibrosis, scoliosis, morbid obesity. These are all challenging conditions. But what's important for the board exam is to understand that the plateau pressure is going to increase. We're going to have an increased plateau pressure, okay, when the compliance decreases. And because the plateau pressure increases, it's also going to increase the peak inspiratory pressure by the same amount, okay? So it's important you understand that with increased airway resistance, we're going to have an increased PIP, but the plateau pressure will remain the same. And with decreasing compliance, both the plateau pressure and the PIP are going to increase.